Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Taylor Fisher.
And we just want to start by thanking our listeners for all the support, for following and sharing with your friends and family, and encourage you to leave us a review if you can.
And if there's any other topics you're interested in hearing us discuss, you can submit those on our website at sgmc.org/podcast, and we will try to get our guests to answer them on the show.
And today we have Pankaj Agrawal, MD, family medicine and hospitalist, but most importantly, he's our Senior Vice President and Chief Medical Officer here at SGMC Health. So Dr. Agrawal, what brings you in today?
Thank you, Erica, for having me here today. And, I'm excited to be here today. As we all know, the healthcare system is very complex. It's very difficult to navigate. And I'm trying to shed some light on what we do for our people, our patients, our community, and kind of make it a little bit more clear for everybody to understand what the health system means, what's the physician play a role in there, and how do we connect to the patients and the community and the organization.
Yeah. Healthcare, is probably the most complicated thing to understand. And even many people who work in healthcare, only understand their little role, their role in the big sphere of things. So we're super glad to have you here today. In regards to just being a physician, tell us a little bit about what led you to decide to be a doctor.
And it's so interesting you ask, Erica, and I'm pretty sure every physician has a story to tell what got them into medicine. One thing, we are born with this body, and the body's designed to get sick, and that's where you start feel like, okay, why does this happen? When you are young, you have a lot of questions. Why did this happen? Why did this happen? And essentially this morning, my 10-year-old son is asking me about why these teeth are called canine. So we spent 10 minutes explaining him why he's called canine. So you think through, your mind is curious at that time, but right before my high school, my mom was in hospital for almost 2-3 months, and every time she's not feeling well, or she's coughing, or something's going on, I'm running to a nurse to say, hey, she's not feeling well, what's going on, right? The next day, the doc's on around, and I'm asking him, and he said, yeah, everything is fine. Well, tell me something. So that questions were constantly on the mind to say, can I learn about it? Can I do something about it? So that started a journey into say, I got to do something when I grow up. Why not medicine? So I think that was the first point to say, well, let's think about it. And then I had some support to go that side and more people to lead me that way. So, and then fast forward 30 years later, here I am.
Yeah, that's. I've heard that comment thread. I've heard that from nurses too, that the reason they became a nurse is because experience they had with other nurses, or they had to advocate for a family member in some way, and that kind of led them to the medical profession. So you graduated medical school and then specialized in family medicine, but then you joined SGMC Health. How long ago now?
So it was March of 2017. So it looks like yesterday, but it's over 7 years ago. I joined here as a hospitalist program director. That was kind of rebooting the system in the hospital medicine, and kind of tell a little bit more what the hospital medicine looks like. In early 2000, this new concept came in to say what could be done differently, and medicine has evolved over the last century and decades, and every 5 years and every year and every month you have a new medication, new technology, new procedures. People are living longer, they have more medical problems. So medicine is not becoming easier anymore. It's becoming more complex, and when it became a little bit difficult for primary care physicians to be in an office and run to the hospital to see their patients and go back in office, so nobody's waiting for them. And it starts to stretch them a little thin. And the concept came, can we have somebody who's be in the hospital 24 hours and be available to these patients who are getting sicker, and be available right away for their needs. So when these patients better go home, their primary care doctor is available back in the office to see them once they got home. So we not stretch the system further thinner. We support the system, and that's where the term, the hospital-based medicine or hospital medicine or hospitalist word came up in early 2000. And since then, pretty much, I would say 80 or 90% healthcare system in a hospital has designed that, supported that, and now there's a dedicated group of doctors who essentially specialize in those acute care to provide the service for, these individuals in the hospital. When people are sick and hurting and they are in I would say, the worst time of their life, you have physician available at their bedside in a matter of a couple of minutes. So they don't have to wait for, or the people waiting in the office for the doctor to come back from the hospital. So I think it worked very well, and then with the evolution of EMR, both primary care doctor and the hospital, they stay connected. They still be able to have a visibility of what happened to you in a hospital and what's going to happen when you go home. So the concept evolved from just not the medicine part or internal medicine part to some other service lines eventually, because the system continued to evolve. You could see similar things coming up in the pediatrics to say, do you have a pediatric hospitalist, which we start to have the service line to be able to provide care for a little bit more sick patients or a little bit more volume if you start to, go in that side. We start to provide similar services as an OB hospitalist. So when somebody's in the active labor and show up and they need immediate attention, we don't have somebody to drive in there, right there available for them to be able to provide the medical care those patients need in that moment. Mm-hmm. And similarly, other service lines continue to evolve in a gastroenterology because there's, as we spoke, patients are living longer, having more medical problems, they're on more medications and the side effects show up and the complications happen. So we start to go on to providing more acute gastroenterology care in the hospital when they're here. So again, these physicians available in a matter of few minutes to provide immediate care. And, again, another set of gastroenterologists available in office to help them when they go home and better and try to provide more preventative care services for their screening, colonoscopy, and, stuff like that.
It's interesting that you mentioned gastroenterology because my dad just had a experience recently here with one of our hospitalists in gastroenterology, and she was fantastic. I was very happy she was able to come into the ER where he was there, talk to us, and take care of him. And it's awesome that she was there and that we didn't have to just wait around for a doctor to be able to leave his patients and come.
Yeah, I think so I know there's a few primary care physicians or other specialists that still see patients in the hospital and come around. And, of course, Dr. Greiner is a well-known physician in our community and also serves on our hospital board of directors. And I remember quite early in my career, seeing him coming through the hallways, rushing up to the stairs, and then I had my children and they were patients of him. And I thought, how does he do it? Because he's literally always here at the hospital. Like, how would he ever have time between being at the hospital and at the clinic and seeing patients? Then couple that with the lack of primary care providers in general in the nation. So if you don't have a primary care provider, if you didn't have the hospitalist, you wouldn't have anybody to see you then in the hospital. And the fact that 70% of our people don't have primary care providers. So just the need, I think, of the hospitalist
Correct.
and then how it's evolved has really, taken off. And then, and to my knowledge, it's been, very successful in the overall realm of medical care.
And they complement the primary care provider. So, you could try to do everything yourself, or we split it up and do very well, and you can go look at the studies over the last 20 years been published about when, hospital medicine has brought in a quality, consistency of care, which certainly you can believe upon to say this service has become really ingrained in the health system and is here to stay.
And you talk about like physician burnout too, as far as quality of life for the private practice physicians, and then also for our hospitalists. I mean, that has to help. I mean, think about OBGYNs being on call all the time, having to come in to deliver babies all throughout, and then emergencies happen all the time. And so I do think it probably provides that little bit of support for our community doctors.
Absolutely. I mean, the way we talked about the medicine is getting difficult. Even our lives are getting complicated too. You have to start to learn where to balance so you can have a longevity in your career and your own personal, physical, and mental health. How can I continue to do this until I retire? The physician shortage is real, and we need to be able to support that so we can continue to care for the community before people starts to say it's just too much, I can't do it anymore.
Yeah. I know we spoke with Dr. Hardy on a different podcast, and he mentioned spending hundreds of hours a week, in the hospital, and I mean that is such a commitment. I mean, and you also oversee our graduate medical education and our physicians, but talk about a little bit maybe the path of becoming a physician and kind of what that really means. I mean, you dedicate your lives to helping others, but I mean, it's a large investment that's undertaken on the forefront and then your entire career afterwards. What is that like?
You're right, Erica, and I appreciate for the recognition because that's a commitment. It's a commitment for life. It's hard for you to go half the way and I don't want to do it, go back because you invested so much on it. I mean, you got to do 4 years of pre-med, then you have 4 years of medical school, and none of them is easy to begin with. Amount of hours you got to put in the study, and we were taking a tour on a medical school yesterday, and some of those books showed up on the library bookshelf, and I was like, makes me nostalgic looking at those books because I remember how many hours I have spent that book, and just like, I don't want to look at this again, but I know that's the amount of time you have to dedicate yourself, and you miss out on your family life and your social life, and you just have one mission that I want to be a doctor, and I want to be a good doctor, and how do you do that? And once you have the medical school and you look for, okay, what do I want to practice into? You look into your choice of specialties, and you start to decide my priorities, and you decide to apply for a residency program, and that's across the country. There are like thousands of options, and you have to decide, where do I want to go? What do I want to do? Why do I want to go? So the journey constantly challenges you what you want to do and why you want to do. Just kind of self-reflect at every step. Am I going to be successful in there? Can I afford to do that? So I made a decision I cannot do surgery. So I stayed out of that because I knew that I cannot spend 10 hours at bedside trying to do a surgery like Dr. Hardy, what he's mentioning, to some of those procedures last for 10 hours. So you had to know, where do you stand? And then once you apply for the residency, you got to start to pick a place where it's going to be a good fit for you. Go meet folks over there, try to find what's their training program looks like, what's their culture look like, and again, is it a fit for me or not? And then eventually you create your rank list. If I gone to 10 different places, and this is my first choice, and my second choice, and third, and fourth, and similarly all the programs you gone, they rank their candidates, and then eventually the computerized matching process will go on to say the candidate's choice and the facility's choice go into a random pattern, and then you get to know where I'm going to go and what I'm going to do. So most I would say most folks know what specialty they want to go, so they not necessarily applying in more than one specialty. Those parts are very clear before you get to that point. But what facility I'm going, what hospital I'm going to go, what program I'm going to go, that's kind of determined on that. And, again, the times have changed, the medicine have changed. About 13, 15 years ago, you would be working 36 hours straight every third day. So that's your normal day would look like, and still remember on my first day, you get an orientation from your senior resident, and he said there are 3 rules to graduate from here: eat when you can, sleep when you can, and study when you can. That's it.
Eat, sleep, study.
If you remember that,
Don't do anything else.
you'll be fine.
You're wasting your time.
You'll be fine. So
Yeah.
those are 3 rules to survive out of it. And I think those were true, and
Yeah.
that's still, and then now, as we know more about things, we have more studies behind it, and we kind of know more how the human learning works and human behavior works. And then the ACGME, who controls I would say, the learning environment for the residents, have, changed the regulations based on the historical evidence to limit the number of hours that you're not required, and you cannot work that long of hours. As risk of making errors or being tired, or because now you're driving home after those 30 hours. Just remember how tiring that could be. So, and I remember taking a nap against the wall, leaning in, just taking it because
Yeah.
you're just so tired. So things evolve as it goes, but I think everything brings in a value. What you learn that you could remember for life and take good care of the patient. So the process is pretty rigorous, and there's design, and that's for a purpose. That you're gonna be having somebody's life in your hand, and your decisions gonna matter for them and their family and their loved one forever.
And so that leads me, I think, right into when you accepted the role as chief medical officer. Did you know what you were getting into? But that's one question. But secondly, it led you, you already were involved in several quality improvement, patient safety initiatives throughout your tenure here. So I know that wasn't necessarily new to you, but a lot of, I would dare to say, no one really understands what all that department does within a health system, and how we do truly, or there's a team, pretty much any service line really evaluates almost every aspect of their service line for quality, for safety, and how do we get better. What are some of those metrics that y'all kind of look at that impact our patients and our community members?
That's a very heavy question, Erica. I know Mr. Dean, our president and CEO, he always says impeachable credentials, and that credential means the patient safety. So that's in very forefront of all of us in our mind. When we approaching a patient, we're going to do anything and everything. And remember, the system is very complex. Everything, every process, every tool, every medication, every patient has to go through several different hands, and how we can make sure we close the loop and do it safely without harming the patient, because, patient harms are real. Hippocrates, who was father of modern medicine, he said 3,000 years ago, do no harm. He knew that it's going to happen. And gradually, as health system become more and more complex, it's becoming more and more evident until, I would say about 20 years ago, there was no much stress on patient safety in healthcare. But the National Institute of Health in 1999 published a study showing how many people are dying every year due to healthcare-related errors, medical errors. And so that becomes real. And historically, in about over the last 20 years, the medical error has been staying number 3rd or number 4th cause of death across the nation. So if you think about it, every 4th person had a cause of death related to medical error. COVID pushed it down a little bit, but then it's back up since COVID's gone down. So as a healthcare system, everybody has a lot of way to go to make it a safe place for all of us and for a journey to a zero harm. So one of my, I think I'm still trying to figure out my role as a chief medical officer. I try to have everything comes on my way to evaluate if I have anything I can assess and do it. Out of my 4 major departments, one of the heavy lifting we do is a patient safety and quality. I got great team. Scarlett Rivera leads that team, and she's phenomenal, and she's the guru on every aspect of her department. I cannot believe the knowledge and she has. And I can tell you, in my role, when I knew case management, social work, I knew residency, how it works, because we all going through that one. But the medical staff office is third department, which is more credentialing and allowing people to work. So that was a little bit learning, but the biggest learning I had for myself in the last 8 months is the patient safety and quality. Although I've been engaged, but I think I start to look at it as a different lens now. And you kind of trying to zoom in each time when something goes wrong to say, well, where is the problem, right? So we need to be able to reproduce the same thing like an assembly line every day, every time, every second. It comes out perfect. You cannot assume a Toyota making cars with the leaky fuel tanks and they don't realize for 100 days that, come on, we made 1 million car with a leaky fuel tank. Now imagine the impact down the line. And, so we bring those back to healthcare to say, everyone need to do every day and every time. The processes needs to work. The policies needs to support that. And we need to be able to support people to be able to perform that.
Yeah, that's big. I mean, that's, SGMC Health started a few years ago this journey to become a high reliability organization, which really focuses on safety and zero harm and really being accurate all of the time, every time, not making it, but really creating a culture where our employees, every single person, no matter who you are within the patient experience, takes responsibility for their role and taking responsibility for keeping the patient safe, even if you're not a direct caregiver, right? So it's been a nice on my ass. I mean, I don't touch a patient ever, but even being a part of these trainings and kind of seeing what our team is going through, it's just eye-opening to me. It makes me feel a lot safer and a lot better knowing that there is such a focus on that within our organization and that it's not like a taboo topic. It's something that should be talked about all the time and very often so that it's front of mind for all of our team members. Because not only do we not want to hurt, no one wants to ever do anything wrong. So it also creates a better work environment for our team if they feel like they can do their job well.
Everyone can do. I'm constantly seeing our team have set a great example by picking up trash in the hallway and wiping up spills. We're not patient caregivers, but we can do things like that.
But you're supporting their preventing a fall.
Yes.
There you go.
Yes.
So that goes to safety. So did everything for a reason, right? So, I think the high reliability journeys, again, that was new to me, but has been, again, an eye-opener. Again, healthcare is compared with airlines industry all the time.
Yeah, so this came from like the airline industry,
Airlines
right?
And
Nuclear plants, because those are very high risk situations, right? You don't, if airplanes start crashing out of the ground, if as many people died on airplanes, it's like the industry would shut down, right?
Correct.
We can't shut down the healthcare industry, so it's our job to mimic their results as good as they are and get better and better and better.
Let's tell you a little bit more on the journey of HRO and from the clinical side. How does it matter? How it impacts? So these we have complete program of high reliability journey, and every single individual is being trained on it. And like you said, bringing in a culture of transparency. We need to know what's going well, what's not going well, what we could do differently, and try to stop anything that could before hit the patient. We want everybody to be able to speak up and feel comfortable to say, hey, I see something that probably could go wrong with patient. Let's fix it before it happens. And the harm to a patient in healthcare is looked at a Swiss cheese model. If all the holes align, and that's where there are multiple levels of, I would say, safety nets to say if a physician orders a medication, pharmacists have to look at it to say, is it safe to dose, the right amount, could it interact with any other medications, then he will release it, then it goes to the nurse. Nurse will still look at it and make sure, does it work, does the patient even take this at home, or is something new, or they're allergic to it, before it touches the patient. So every process we have, they're going to have multiple layers of safety checks before it goes to the patient. But when you start to lose those safety nets and all the holes align, that's where the harm reaches to the patient. And the purpose of HRO journey is to eliminate those holes from the Swiss cheese. So you have no holes. Every process is strong enough. Every employee, every healthcare worker is strong enough to say, nope, stop, think, review, and act. So you come up with this new culture that every single person is equally responsible and leading the patient's safety in the front end.
Yeah, I think probably the most common thing that I can think of in healthcare that the patient would immediately recognize is the patient identifier, and make sure you have two ways to identify, and that they're reading those back, confirming those. And then, correct me if I'm wrong, but did this not come from, or what? I know there's the timeout with the surgeons that they have because of this, with wrong site, wrong person. There's always those fears that you could go in and have the wrong surgery and things like that. So just as many processes that can be in place, because we recognize that everybody is human and humans make mistakes. So getting as many processes in line that can eliminate room for human error.
On the other end, we talk about the quality. So yes, we want a patient to be safe, but on the other side, we provide them a quality care. It needs to meet the standard of care. It needs to be the highest quality we could provide. And there are a lot of metrics when you were asking about early, how do we measure it? So there are measurements for every single quality that we provide. A bunch of them has been designed by Center of Medicare Services, and then other governing bodies. They regulate what happens in healthcare. Not only a complex, healthcare is also very highly regulated from different governing bodies. So we have to be able to produce all those quality data, and a lot of them are publicly available on our website for anybody to be able to view that. So cmscompare.org, that can help you compare what this hospital safety rating and a quality rating looks like compared to the hospital B. CMS star rating. So all of those are quality metrics eventually rolls into there, that how does CMS find us being good, safe, quality hospital compared to other similar size hospital in a region or a nation. The Leapfrog score rating is another way, for encompassing all different things we do to provide good quality care to the patient. Say, where do we stand compared to the other hospitals that provide similar service lines that we do.
Right.
have.
I think that's got to be something you think about too. It's obviously we want to be the best of the best at everything. That's what we strive to be. But when you're comparing hospitals, knowing that some hospitals are caring for much sicker, more intricate cases. So that could, sometimes there is a little bit of variant in those quality metrics just because smaller hospitals may not have those specialties to care for critical care patients or things. I think
Correct.
That's what I've heard. Okay, make sure I was right on that because I'm not 100%, but that's what I thought. So that is, something to keep in mind. Sometimes that can track or trend things differently, but ultimately we still want to be the very best that we can.
And I enjoyed the quality since the beginning because that's the one way we can hold ourselves accountable. Are we delivering a quality care or not? Patients come to us trusting us that we're going to do the best for them, but are we able to prove it?
Yeah.
Are we able to account for this? Are we able to stand and show it to the community and other places to say we are doing the best thing that we can do for our patients? So it's a great tool to self-reflect.
Recently, we did win or receive an award from the Georgia Hospital Association for the work with the organ donation procurement. And you can talk on this better than I can because you were involved in it. But it was enhancing processes for timely organ donation. I think we don't do organ transplants here, but securing organs for from donors. To go. I have several family members who are in need of an organ, so that's definitely something that's very important. You want to talk a little bit about that real fast?
It's again, I'm going to compare with cars and airplanes. You can build another engine and put it in a plane, and the rest everything could be the same, and you can use it. You can change the tire, and the car will go. But that doesn't apply to the human body. There are some things you can use prosthesis and artificial things and a dialysis for replacement of kidneys, but there are other things you just can't. You don't have it, and you heavily rely and try. That if somebody could donate to you. Sometimes people, if you have a more than one, like kidney or a bigger organ like liver, those could be donated from a live person and could be utilized. But most of the other organs we got, you just have one, and even if you have two, you can't live without it. So you can't start to donate. And this is where the humanity goes to its peak, where somebody has an untimely death and having healthy organs. Could those be donated to somebody who's in the need? So that's where it becomes very sensitive, that those donation process has to go through a very good screening to figure it out. Is it going to be viable, or is it going to harm the recipient or not? So, and as a nation, as a health system, we all strive to say, can I notify people who do the organ transplant to say, I might have a candidate. I might have a candidate. And so there are criteria, and that's what the stride we made in the last couple of years to say, identifying those people in a timely manner and notifying I think it's called
LifeLink of Georgia.
LifeLink of Georgia. They are the coordinating agency to procure those organs. So I believe, over the doubled amount of referrals to them by simply changing in our processes to say, we're going to notify every time when X, Y, and Z happens. And we simply were able to help few more people in a timely manner just because putting the process in place.
Yeah, and just to dispel any myths or anything out there while we're just on this topic real quick, is that, I do recall that I've heard someone, they don't, maybe not trust that if you're an organ donor, that the hospital will take care of you because they want your organs. I definitely have heard that before.
Yes.
I know that's completely false. But tell us a little bit about how that process worked, because that's never the case.
Now, again, I'm not expert in the process, but it's a centralized process, and we have none to zero control on it. Once we identify somebody, the team will review that remotely, and the team comes on site from LifeLink, and they have their own team to procure the organ, and they have priority list in a state where it's going to go first, based on their need, based on how critical situations are. So that definitely goes for a good cause, without any doubt. And those are used to save sometime more than a couple people lives, because different organ could be helpful to different people. And so the impact of that is just phenomenal. And I can't thank those people who designed, decide to go that pathway, and their family take the decision for them to say, I want to help other folks.
And it's always super cool when you can, when they find out years, because I think it takes a while before they can even release who the recipients to those organs are. And then they get to do meetups sometimes or connect with those families. And I always think that's super powerful. Today, I know this isn't the day that we are releasing this podcast, but the day that we're filming is actually National Donate Life Awareness Day. So I just kind of wanted to bring that up, but I wouldn't never want anyone to fear registering as an organ donor because they would think that they get any less care. So I just wanted to dispel that. But.
And do want to make it there, we as a complete health system and healthcare workforce, we have a humongous amount of respect for those patients and individuals and their families for the decision what they're doing. They are
never
looked
forced
at,
on anyone.
correct, and they are looked at with utmost respect and dignity throughout this process.
Right.
So we do understand that we need to be respectful for them throughout the process.
Yeah, it's a very difficult decision to make, but truly respected by everyone who interacts with those families.
I've gotten to be here for 2 honor walks, I think, since I started working here, and I didn't know what that was before I started here, but I remember the first one that we went to, it was just the patient's family had asked if we would record, so we did that, and it was just the most humbling and just emotional experience, and you really feel that this is a huge thing for them, and just the amazing gratitude for them making that decision. And it's a really cool thing.
Now, my father is not a medical person. He has no clue, but he's told me several times that he wants to donate his body or organ, whatever is possible, for several years in a row. So, I never asked, he himself offered. So there are, people have the desire, and we want to fulfill the desire for them and other people who could help.
Yeah, absolutely. All right. Well, I think we're at time. Okay. Kara was shaking her head. All right. You asked the last question.
Oh, yes. We always have one last question that we ask, and it's just universal. Most people have to eat here because they are here all the time. So what would your favorite meal be, either in the cafeteria or in the Spice?
Put me on a spot. Jason is going to find me. No, I think we have done some, I think, healthy Wednesdays in cafeteria.
Wednesdays, yeah.
So on that day, they have like a specialty counter, and I seems to find a little bit more different. That obviously you could bore by the same item, but they have a little bit more different, and it kind of changes weekly. So that station remained my favorite for a long time. They kind of became creative with that one.
Okay.
And also, I'm just giving this plug because I want to tease Kara Hope over there. But Dr. Agrawal also has a good fitness routine, because him and I both go to Orange Theory. And actually, we are the Capture the Flag champions at Orange Theory. We were partners, and we beat out everybody else in our class to capture the flag one time. So if y'all ever want to exercise and need a healthy option, Orange Theory Fitness it's a good one to try. But we are the champs.
All right. That's a good one.
All right. Well, I guess that's it. Yep. Okay. Well, thank you very much, Dr. Agrawal. We appreciate your knowledge, your dedication, and expertise. And we're just glad to have you in the role that you're in, because you're truly making a difference. And I feel good. I feel confident with
I'm
with you
pleased
at
to
the
be
helm.
here, and I feel blessed to be here, and thank you guys for inviting me.
Thank you. All right. Well, until next time, thank you guys for watching.